I've cleaned my hands to help prevent the spread of infection. Good afternoon. My name is Carrah. I'm going to be the nurse doing your physical assessment today.
Carrah.
And can you just go ahead and just tell me your name?
Valerie McCormick.
Okay. What's your date of birth?
10/17/59.
Okay. I'm just going to ask some questions just regarding just orientation, just questions for that.
Okay.
Can you tell me where you're at right now?
I'm at the hospital at Tosh Hospital.
Okay. And what is today's date?
August 5th.
Okay. So Valerie is alert, awake, oriented to person, place, time, and what are you here for today?
An examination.
Okay. And she's oriented to the situation. Her mood and affect is appropriate for the situation. Okay. I'm just going to go ahead and begin my exam.
Okay.
I'm going to first just lift your head and stuff, right?
Okay.
Her head is round. It's symmetrical. It's normocephalic. Her scalp is whitish pink, just slightly moist. Her hair is brown with some blonde highlights. It's thick, it's evenly distributed, and there's no parasites.
Thank you.
Her face is symmetrical. Her skin tone is tan, and it's throughout her face. There's no lesions, there's no rashes. Her eyes are on the upper third of her face. Her nose is midline. Her mouth is on the lower third of her face, and everything is symmetrical. I'm going to go ahead and just palpate your carotid artery here. Listen to it. Just kind of turn your neck to the side and then hold your breath while you do this. Just kind of tilt your head a little bit. And just tilt it like to the side. There you go. Okay. And her carotid is a regular rhythm. There's no bruise present, and it's equal on both sides. Her neck is symmetrical. And then I'm going to go over just your lymph node. Just let me know if you have any tenderness on the places that
Okay.
are kind of fresh. Okay. We got preauricular, posterior auricular, occipital, submental, submandibular, and then tonsillar right here. And then these are the superficial cervical, and then we got posterior cervical, supraclavicular. Okay, and then if you can just tilt your head to the side, and that's the deep cervical chain, and on the other side, and then deep cervical chain. Okay, I'm gonna go move on to your eyes. Okay, her eyes look symmetrical. She has eyebrows that are symmetrical, brown in color, evenly distributed. She has eyelashes that are everted. The sclera is white. Oh, look at your bottom here. The conjunctiva is pink. I'm going to use my pen light. I'm just going to shine this light in your eye. Okay, the pupils are equal, round, reactive to light and accommodation. If I was to use an otoscope to look into her eyes, I would be looking at the internal structures in the eye. You would look at the red reflex, which is the red glow of the pupil. You would look to see if there's any shadows, and there should not be any shadows. And then you would be looking at the optic disc, which is creamy colored. Okay, and then I'm going to look at your ears. They are symmetrical, they're elastic, there's no lesions on the skin. The skin is uniform over the ears. She has a piercing in each ear. Let's see, tell me if you have any tenderness in these areas.
No.
Here, okay, so no tenderness in the auricle, tragus, or the mastoid process. I'm going to shine a light here. This time. There's no cerumen present and no foreign bodies. If I was using an otoscope, I would be looking to see if there's any redness, drainage, swelling, And then I would be looking for the temporal membrane, which is going to be translucent and shiny in a pearl gray color, and I'll look for any perforations on the tympanic membrane. Alright, I'll move to your nose. It's midline with the face. Can you just close one nair and breathe in, and then do the other side? Okay, both nairs are patent. Just tilt your head back again. There's no deviation of the septum. Okay, in your mouth, her lips are pink. She has some lipstick on there. They're moist. There's no cracking. There's no lesions. Her mouth. Okay, I'm gonna look inside your mouth. And then just stick your tongue out. Okay. All right. So the buccal mucosa was pink and moist. Just smell for me. Her teeth are white. They're straight. They're in good repair. Her gums are pink and no swelling, no bleeding, no edema. I'm gonna look on the top of your tongue here. Okay, the dorsal side of her tongue is white and roughened, and then the bottom, the ventral side is glistening with veins. The hard palate is white with transverse rugae, and the soft palate is pink and moist and smooth. Alright, I'm gonna move on to your lungs. For this, I'm gonna have you just kind of sit on the side of the bed. Okay, there we go. Alright, so her anterior and posterior diameter is a 1 to 2. It's wider posteriorly. Her spine is midline. On the lateral view, it's in an S shaped. I'm just gonna feel around here, tell me let you know if you have any kind of tenderness, okay?
Okay. No.
Okay. I don't feel any lumps present. And then we've done this before, so when I put my palm on the back, every time I put my palm down, just say the word 99, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, there's no tactile fremitus. The vibrations are about equal on both sides. I'm gonna check for a chest expansion. Just take a deep breath in for me. Just a couple of them. One more. Okay. Chest expansion is equal bilaterally. And I'm gonna listen to your lung sounds now. Just take a little bit deeper breaths in through your mouth, okay, than your normal breathing.
Okay.
There's vesicular lung sounds in all lung fields and no adventitious lung sounds. I'm gonna let you just lay back on your back again. Listen to the front side. Her breath sounds are clear with no adventitious lung sounds. Just gonna check your turgor right here. And her skin turgor is good. Okay, now we're going into cardiovascular.
Okay.
I'm just looking at her chest. There's no lifts, heaves, pulsations noted. If you, some people you can see that with at the mitral region. I don't see that with hers. Go over some landmarks. This is about the. This is the aortic would be the aortic valve, the second intercostal space, or where you would hear the aortic valve, second intercostal space on the left sternal border. The pulmonic valve is at the second intercostal space on the right sternal border, or on the left sternal border. I think it should be the right for the aortic, left on. And then the third intercostal space would be Erb's point, and that's on the left sternal border. And then you move down to the fifth intercostal space, which would be the tricuspid valve, and it's on the left sternal border. And then over here to this would be the mitral valve, which is the fifth intercostal space at the midclavicular line. Okay. I'm gonna listen to your apical pulse. Okay, I have to listen to it for a minute here, okay?
Oh, absolutely.
Her rate is 64. It's regular, and then I'm gonna just kind of and it's not palpable. So if I was to listen to other areas of the heart, the S2 should be heard more accentually at the aortic valve and the pulmonic valve, and then the S1 should be heard more accentually at the tricuspid valve and at the mitral valve. And at Erb's point, the S1 and S2 would be heard equally. We'll move on to your abdomen. I'm gonna lower you just a little bit for this one.
Go right ahead.
Could you just lift your shirt up just a little bit? Okay. So her stomach is flat, it is tan, there's no lesions, the color is uniform throughout, there's no striations, I don't see any scars. Her umbilicus is midline, it's inverted, I don't see any pulsations or peristalsis. So I'm gonna listen to your bowel sounds. Start in the right lower quadrant. Her bowel sounds are active in all four quadrants. I'm just gonna palpate you, leave your shirt down. I'm gonna palpate. So in the right lower quadrant, the organs that would be present there would be the appendix, the cecum, the right ovary, the right fallopian tube, the right ureter, and in a male, the right spermatic cord. Move up to the right upper quadrant, you would have the gallbladder, the liver, the head of the pancreas, the left kidney, the left adrenal gland, the part of the ascending transverse colon, and then the hepatic flexure of the colon. Okay, and then moving to the left upper quadrant, you would have the spleen, the left lobe of the spleen, the stomach, the left kidney, the left ureter, the part of the transverse descending colon, and then the splenic flexure of the colon. Alright, and then in the left lower quadrant, you would have the sigmoid colon, part of the descending colon, the left ureter, the left fallopian tube, the left ovary, and the left spermatic cord in a male. And then midline, you would have the aorta, and then the bladder, and the uterus. Did I say right kidney on the right kidney and right adrenal gland. You can pull your sleeves up. I'm just going to check peripheral vascular. Legs. Okay, the skin is warm, it's dry, there's no lesions, there's no varicosities. It is uniform tan throughout. I'll look at your nails. Okay, they are convex. The nail bed is pink. The capillary refill is less than 30 seconds. On both sides. Okay, and then I'm going to assess some of your pulses. Okay, I'm going to do these at the same time. Okay, her radial pulses are 2+ amplitude, and her rate is regular. Assess brachial. Okay, her brachial pulses are 2+ amplitude and their regular rhythm. Down here. Okay, the posterior pulses are 2+ amplitude and they are also regular. The dorsalis pedis pulse is 2+ and regular as well. Okay, there's no edema in either extremity. And we'll look at your nail bed here. And she does have a less than 30-second capillary refill. The nails are convex and pink tissue around. That is the conclusion of my assessment for you.
Well, thank
Everything appears very normal. I'm glad you came in today.
you. Thank you, Carrah. Thank you. Thank you.